Well, studies show vaccines have been effectively preventing certain diseases for over 100 years. Currently, health departments are working nonstop to get as many people as possible vaccinated for COVID-19. And the CDC is encouraging every adult who is able to receive it, do so as soon as possible. This morning, we are joined by Dr. Angela May, Deputy Chief of Staff at Mountain Home VA Healthcare System. And we want to welcome you to the show. Thanks for joining us today.
Thank you for having me.
I know you guys have just been extremely busy. Of course, the vaccine, kind of that light now that we've been getting after just an incredible, difficult year with the pandemic.
Absolutely, and it's such a ray of hope, and it's brought so much joy and happiness to people to be able to do something to get to the end of it.
Absolutely, and you guys put out that word. You've been offering the vaccine through different clinics and opening up that to as many veterans as possible.
Absolutely. Any veteran of any age can get a vaccine now, and they can come Monday through Friday. We have an open walk-in clinic in building 160 on the second floor, so any veteran, any age.
And I got the opportunity to be there one of those days that you guys were holding the clinic, and so many people so relieved to get this shot. Has to be really rewarding for you to kind of see this process.
It's been very rewarding as we do the vaccine clinics. I've had a chance to meet the veterans, talk to them, ask them their screening questions, and they've all just been grateful. And I've been grateful for their service and grateful to be able to give them the vaccine.
Yeah, and as you're doing this, I'm sure you're answering a lot of questions as well, and maybe even some concerns.
Absolutely, absolutely. But it's been nice to be able to answer them one-on-one so that when they're screening, I can address their concerns.
Well, one of the concerns that I know you get asked a lot is talking about the different side effects that we're seeing regarding the different vaccines.
Yes, absolutely, because any vaccine can give you some side effects, some muscle aches, fatigue, maybe a low-grade fever. I consider that a positive sign. That means your immune system is working and building. So I think most people, it's been very manageable with just maybe some Tylenol and rest, maybe take a day off work, but it's usually quick-lived, gone within 48 hours.
Yeah, the most I have heard is a lot of sore arms.
Yes, mostly sore arms.
And that's because it goes in the muscle?
It sure does, just like most of our other vaccines, like the flu vaccine that people get every year.
Okay. And then I know a lot of people, the big question is, how long is this vaccine going to last?
You know, unfortunately, this is new. We're in new territory and we're not positive. With the viruses mutating and changing strains, we're not sure if we'll need to do annual boosters or not. We're very new in this process, and it seems like it's been going on a long time. But actually, this has really been rapid. This is historic, how quickly this vaccine has been released. So we're still gathering data. And over the next year or so, we'll have so many people vaccinated and more studies going on that we'll have more information about that. And of course, we'll release it as soon as we know.
One of the things I really have enjoyed about this whole vaccine process is just how transparent everybody. It's like you said, well, this is new, so
Right.
We're still learning, but a lot of people questioning the timing, and I understand really just the studies and everything were done like other vaccines.
Yes, of course, under an emergency use authorization, you have to show that this is a actual emergency that requires rapidity, but still this was done on thousands and thousands and thousands of volunteers. It's just that now, as we get more data, it will be done on millions.
Wonderful. And a lot of people also talking about masking and social distancing as they get that vaccine. What are you guys recommending?
Well, right now, if people have completed both vaccines, if they've got a two-step vaccine, about 2 weeks after that, they can gather together in small groups without their mask. And the CDC has put that recommendation out as well. But because there's still a lot we don't know, and we're not sure about the transmission of the virus yet, but we will know in the future, we're still recommending that out in the general public that people go ahead and mask and use hand hygiene and socially distance. You don't know who's had a vaccine and who hasn't.
I know I just feel better when I'm in the grocery store or in anywhere where I'm closer to people. It just feels good to have that protection.
Well, and I think also that protection to know that you're less likely to spread anything, whether it's COVID or the flu or another respiratory illness that maybe this person in line might not be able to handle. So I think social distancing, masking, using hand hygiene for now is still the safest course.
And Dr. May, one of the questions that we hear a lot is, if I've already had COVID-19 and I recovered, do I still need to get the vaccine?
Yes, we recommend that people go ahead and get the vaccine because the studies show that it's very safe if you've already had COVID, but what we don't know is how long immunity is going to last if you had COVID.
And what about for those with underlying health conditions that were a little bit more vulnerable when it came to COVID-19?
Well, absolutely. The vaccine has been shown to be safe in almost all underlying conditions. You really should check with your provider to be sure, but those are the very people that need the vaccine. They need the protection more than anyone else, and we recommend they go ahead and get the vaccine.
Certainly some great information, kind of putting people's minds at ease. And I know, like you said, you are doing these clinics. Tell me again where veterans can go to receive the vaccine now.
They can come to the Mountain Home VA Medical Center, so any eligible veteran who's enrolled may come to Building 160, the second floor, Monday through Friday until 3 p.m., 8 to 3 p.m., and get a vaccine just as a walk-in. They don't need an appointment.
Wonderful. There is that information right there. As she mentioned, Building 160 right there on the second floor, Monday through Friday, so happening right now until 3 o'clock today, and then, of course, the rest of the week. Dr. May, great to have you on the show.
Thank you. Thank you for having me.
We'll be right back.